All right, how's it going, everybody? This is the first Facebook Live I think we've done, but we're here at the Southern Spine location in Anna, and at the Rise Performance Building, of course. I got myself, Clay, with Grit Training Systems. We've got Destiny with Primitive Strength, and of course Dr. Pedigo with Southern Spine. And we are going to go over some squat variations, as well as Dr. Pedigo is going to talk a little bit about some common things he sees with pain and things like that within the squat. So we'll go ahead and get started.
So before I start, if you're not a member at Rise, you need to be. We have literally everything under one roof. We collaborate with clients and patients all the time. I handle the pain and the injuries. They handle the fitness and the strength, and the beautiful blend between them all really is making these clients succeed and reach their goals even faster. They do online programming too, so you don't have to worry about living in Anna or getting to Anna every day. And then I have the clinic in Marion. But ultimately, we want to kind of focus on a few specific things with the squat, the things we see the most. Obviously, being a chiropractor, I see a lot of low back pain. And a lot of people blame it on the barbell back squat. However, it only takes a few adjustments as far as your movement mechanics and a few different techniques, and you're going to be golden as far as the barbell back squat goes. The majority of people with pain from barbell back squatting struggle to stabilize the lower part of their lumbar spine or their low back. So the couple of vertebrae, the segment right above the butt, essentially the low back here, they can't really stabilize that very well at the end of the squat. So they may be pretty good at bracing and really getting that intra-abdominal pressure going, but as they get deep into the squat, from the part of getting to the bottom of the squat and then exploding up, that quick transition is where we see a lot of pain and injury happen because they can't maintain that stability, that bracing, and that intra-abdominal pressure. So we kind of break it down. We break them down, we build them back up. We go over some diaphragmatic breathing, bracing cues, and then we transition that to Clay and Destiny, and then they work on that in the gym as far as getting that right with the load on their back. So the lumbar spine, the inability to stabilize the lower segment of the lumbar spine is a very common issue, along with bracing, breathing patterns, things like that. And number two, a lot of people get like numbness and tingling in the hands or shoulder pain even just from having their arms like that. And a lot of different things can cause that, but a lot of people lack thoracic spine extension, so mid-back extension. They're not able to extend here to get their shoulders back in the first place. Or they have really hypertonic muscles in this region of their body just because they don't ever work on mobility and things like that. A lot of people don't realize that tight muscles and trigger points and muscle spasms are typically a response to something underlying. So with that being said, if a joint is unhealthy or very dysfunctional, things get tied around it to protect it. It's a neurological response by the body to protect an area of the body from being compromised or further injured. So I'm going to pass it on to them, and they're going to go through some different squat variations, how we transition people back to heavy loads, barbell back squatting. And typically, we're not just throwing them back under the bar. We're breaking them down, building them back up, starting with the air squats, goblet squats, box squats. Barbell back squats are one of the last things they get back to as they get that stability back. So go ahead.
I'll just start with air squats.
Yeah.
Okay.
So normally the first thing we're going to look at when we're asking anybody to do a squat is going to be an air squat, because it's best to start with no load. It's a lot easier to see movement patterns and things like that when there's not other factors playing a role in it. So normally we'll just say, okay, let's see an air squat first off and see how that looks. So, okay. So one big thing we like to look at when somebody's doing an air squat is, what are their feet doing? Are their heels staying on the ground? Are their heels coming off the ground? Things like that. We like to check for any kind of hip shifts or anything like that. So when somebody's kind of coming up from the bottom of the squat back up, are they shifting to one side or the other, which could tell us maybe they have imbalance or some limiting mobility in either their hips or their knees. So we like to look for things like that. We check for things like, are they staying upright? Are they rounding their back? Are they dipping over? Those are things that we don't want to see. We want to see like a nice proud chest throughout the entire movement.
So I'm gonna build off that. So Clay brought up a good point. When you're lifting a lot of weight, especially a barbell back squat, deadlift, things like that, the center of gravity is a huge component. So if someone has a big load on their back and they like to round like this, you're literally taking, instead of the straight line, it should be straight down and up. You're literally taking all that load there, straining all of this. Then you're going like this, losing the stability here. So when you're rounding with that weight, you're changing the center of gravity, which ultimately is going to take a toll down the body. So it's really important to follow these cues to keep the body healthy long term.
Yeah, which is exactly why, like I said, we start without the barbell on the back, because anything, we add that barbell in and that's just going to further any issues that you already have. So we want to see what it looks like before we add that in. So
let's go over goblet squat.
Yeah, go. So normally the next thing we like to go to kind of add some load to the squat is a goblet squat, and Destiny's going to show those here. So again, we're looking at kind of the same things. We want to make sure the heels are staying down. We want to check that the hip mobility is good. They're not shifting from side to side. But what this is doing, this is adding some load similar to what a back squat would, but instead of the load being on your spine, it's kind of on the front portion of your body. This helps a lot with learning how to brace. So a normal air squat, you still need to brace for sure, but you're not getting that same effect as needing to brace under load. So you can add this in, increase weight and whatnot, and that can really help you learn how to properly brace to keep from rounding over. So.
Yeah, to build off of that too, the hip mobility is huge. So a lot of people, if I had to guess, and I don't have stats behind this, just through your experience, 8 out of 10 people above the age of 45 can't really deep squat smoothly. It may be kind of like hard for them to get. They can't just drop down into a deep squat. And that's kind of an issue because you should be able to do that well into your 60s and 70s. It's just part of how society has become less active and things like that. Joints aren't moving as much in the way they should. So hip mobility is crucial, especially if you're looking to get a little deeper in the squat. Depth isn't always everything. No two people are the same. Everything's individualized. So depth might not be as important for someone that's had a lot of orthopedic surgeries on their lower limb. However, we have to get the hips moving the right way because it's going to take a lot off the low back and the rest of the body because the hip is also extremely mobile. So if it's not moving right and you can't get into that hip flexion and you can't get anything stabilized correctly, it's going to take a huge toll. So from my understanding, you guys take time with your clients at the beginning on mobility. What's some of your favorite hip work to do with your clients?
I commonly use like the hip 90-90 stretch.
Sure.
If somebody's a little bit more limited than that, we can modify it by like either using a table or a box or some different things like that. And sometimes it may just be like in the seated position. Let's try and see if we can even cross one leg over onto the other. Again, it's all kind of individualized, but like Dr. Pedigo said, the hips are one of the major things like in the squat. After we kind of fully assess everything, like Clay was saying, from the ankles up, because again, we got to start with your foundation being your feet. Moving up to the hips then is probably kind of the last thing that we assess.
Yeah, and one thing that I did leave out that we like to look for, we always look for when we're teaching or working on an air squat or a squat period, is where are the knees tracking. So that's another big thing. You don't want your knees caving in. That's another sign of muscle imbalances or lack of mobility, things like that. So that's another big thing that we look at is where are the knees tracking. Are they tracking over the toes? Are they tracking really far out wide? Are they coming in? So that's just another thing we like to look at.
I think it's important to kind of have a disclaimer that There's 1,000 different things we could talk about with the squat, why someone hurts with squatting. So don't just take this short video and be like, this is what's going on.
Right.
Everyone's different. Everyone has a different medical history. Everyone has a different fitness history. This is just some common things we see, and everyone's a little different. Maybe, Clay has no hip mobility, but there's other things contributing to his low back pain when squatting. So don't take this as medical advice. This is completely educational, and I really want everyone who may be suffering from pain to get a full evaluation of their own, whether it be with me, with one of them, or someone else. Don't just keep squatting through pain and stuff like that, because pain it's a warning signal. So it's telling us we need to address something else going on. And typically the place that hurts on someone, the site of pain, is typically not exactly what's going on. It's caused by something elsewhere in the body, and that side of pain is just a result of dysfunction elsewhere in the body. So, and this was pretty fun. I'm assuming we're going to be doing this more often with different aspects of the gym, but anything else you guys want to add?
I don't think so.
No. Did you want to go through the other versions of squat or no?
Sure, yeah, go for it.
Yeah, we can do a...
So after goblet, we need something for a box. I don't recommend this at home.
You want me to do it? You can talk, or...
No.
Okay.
You're talking. Watch me like miss it.
She's still on. Okay. Yeah, so as Destiny was saying, usually after the goblet squat, we like to move to like a box squat because it puts the load on your back to simulate the normal back squat, but then it also takes some of, and what I've noticed a lot with box squats is it takes a lot of this, like kind of the worry that people may have with back squatting. Some people get in their head like, oh, if I put that weight on my back, I just have no confidence that I'm going to be able to squat. Whereas if you put that box there, that reassures a lot of people that, okay, I'm not going to just fall down. So that's the biggest reason why I love box squats, is it really is a confidence builder, if anything else, in squats. So Destiny's going to go ahead and show an example here.
That's really so.
Yeah, so, and you can also, another thing with these box squats is we can adjust the height. So we don't have to necessarily start with such a low box. You can always start with a higher box and ease into it, because like I said, another huge thing with any kind of really weightlifting, but especially back squats, is confidence. So if you don't have confidence in what you're doing, that's going to add a whole nother factor to everything. So sometimes we start a little higher with people and then work into it, but eventually you want to get down to what your normal squat would be like before we would advance to taking that box out.
Go over high bar versus low bar.
Oh, okay.
Which one's good for what kind of people?
So there are two different ways that you can kind of have the bar on your back. There's low bar and there's high bar. What Destiny's doing right now would be considered a high bar back squat. So the bar is a lot higher on her back, more directly over her spine, and this is normally a little bit more challenging for people with a lot of shoulder mobility issues. So when you have a really hard time getting into the back squat position, a high bar back squat is going to be just that much harder. This is where people, like Dr. Pedigo was saying earlier, see like the numbness and kind of tingling sometimes they can get from different things, mobility issues and whatnot. So this is the most, I would say, most common form of back squat. But low bar back squat, as she's showing now, the bar sits a little bit lower on your back, and it takes some of that load off of your shoulders. So the bar isn't sitting as high up on your traps, it's more down onto your shoulders. You can go with a wider grip normally for people with shoulder mobility issues. And it helps with bar path in a lot of people that have issues with it. So
stay right there on that. So I was talking about the numbness and tingling in this position without giving you a 10-hour anatomy lesson. You have a bundle of nerves that form something called a brachial plexus right in this region, and it has a lot of different things that can entrap it and cause numbness and tingling. So a lot of weightlifters get a lot of muscle mass up here, tend to be pretty tight in here. and can develop thoracic outlet syndrome-like symptoms. Essentially, the pec minor is a very common entrapment culprit of this. So obviously when they're in this position, if they're really tight in the pecs, it can get entrapment site on the brachial plexus, causing that numbness and tingling in the hands. So that's another thing, is working on just opening up, working on that thoracic spine extension, kind of getting your chest to open up, relieving some of that tension in the pec minor muscle can help with that as well. So that's just another pro tip for you guys. Anything else you guys would like to add? All right.
Nope.
Thanks for tuning in, guys. Be sure to follow us all on Instagram, Primitive Strength 618.
Yep.
Clay Sherwood.
Yeah, great training systems.
And then Southern Spine Rehab and Rise, of course. We're going to be making more of these videos, so the more you share it, the more it motivates us to make them. Hope you enjoyed. Thanks.
Thank you.